masters in public health, and they're training it like the educational ICTs are extended as well. So there are trainees, GP trainees who are getting a master's in education, public health. So it is possible, but whether or not it's in education, that's something for the future.
One of the questions I often get asked is there's rumour going around about GP extended training programme. I often get asked about when that might be and how long it will be extended to. I don't know if you've got any thoughts on that.
I think that's a very good question. The educational argument for extending GP training beyond 3 years, I think, is accepted, and I don't really think there's any argument about it. The argument would be about exactly what goes into that period. When it will be implemented, I think, is influenced by many things, not least of the fact is that we've actually got 4 nations, not just 3. So you need to have all 4 nations deciding they're willing to somehow work this system. It's also influenced by the GMC Shape of Chaining review, which it seems pointless to jumble up GP training just to have it re-jumbled by the Shape of Chaining. That is being debated and talked about. I don't have a time frame for when it will be implemented. Most certainly, people applying this year will be doing 3 years unless they elect to do one of the opportunities that we've talked about.
We've just received a question from Michael McCormick. Are you aware of any future plans to reduce GP trainees' salary on a national scale? Recent news stories in the media have indicated this.
No, is the simple answer to that. However, I'm an educationalist, not the employer. And I'm not the BMA negotiating with NHS employers, so that will play out however it plays out. I'm certainly not involved in any such thing, and I know of nothing that would suggest that was about to happen.
On a national level, certainly the feedback that we've gotten from the BMA rep, they are fighting very hard to keep the supplement, and one of the reasons they're putting forward is obviously to do with recruitment and obviously retaining from GPs. So it's an ongoing issue, but I can't see it changing anytime soon.
While we're talking about negative stuff, it might be wise to address the future of general practice itself. No light-hearted matter. There was a BBC One programme, Time Out, on Monday, which looked at the pressures that general practice service is under in Peterborough. And one of the questions submitted is about predictions for how a return to out-of-hours service would work, and what about the low morale. And the honest answer to that is, who knows how the NHS will play out. Jeremy Hunt on the programme on Monday night fully acknowledged that general practice needs to be properly resourced, that it is inappropriate for lots of extra work to suddenly be dumped without some form of looking at the resources to help support that work. We live in a changing world. In the 21st century, most of us expect to be able to go to the shops at all sorts of times of day and night, and that is beginning to come into health-seeking behaviours. And I don't know, I'm fascinated as I approach the end of my working life and will increasingly rely on the future general practitioners to know exactly how that's going to play out. My feeling is that whatever model we use in the future, there will be a role for a generalist whose function is to listen to a patient and help them sort out what they need to do to improve their health or improve the way they're feeling about themselves. And actually the rest is all about temporary pressures that need to be resolved, and perhaps the specific structure in which that person works. If I had a crystal ball, I would love to be able to tell you what the NHS would look like in 5 years' time. I haven't, so I'm not going to.
We have a very good question about broad-based training. Could you expand on that a little bit, Graham, to explain exactly what the difference between broad-based training programme is and the normal GP training programme?
Broad-based training program is a program where you do 2 years, not specifically studying the GP curriculum, doing it in community-facing specialties, a wonderful word. So that's psychiatry, pediatrics, general practice, and I've immediately forgotten what the fourth one is.
Medical training,
Acute medicine. So they are very relevant to general practitioners' workload. And if after the end of that 2 years you decide that actually you like what you've seen in general practice and you want to join us, then you can have an automatic transfer into what is in effect a shortened GP program. It's shortened by 1 year?
Yeah. 1 year.
Does someone who does broad-based training have the same opportunities for example, out of training experiences or medical education or whatever, as somebody who has entered GP training at year 1?
Once you're transferred into GP training, yes. We can't give everyone who wants those wonderful opportunities them, so there will be an element of learning competition, but you just do the same as any other GP training who said, this is what I'd like to do.
If you decide to, if you are in the German team, which hospitals would you rotate during GP training on your
Young Tees Valley, the James Cook Hospital and the North Tees Hospital, Darlington and Durham. University Hospital North Durham.
With some going into Sunderland.
With a few, possibly a few in Sunderland, yeah.
What happens is that you accept a position on a training program, and then we sort out specific rotation, into which you will have choice, but kind of clearly we can't give everybody their first choice for every post. So there's an element, and we hope you get some of the jobs you really want, have to tolerate 1 or 2 jobs that weren't perhaps your first choice.
So does that mean that if you apply for GP training in Northern, for example, but anywhere in Northern, or the Northern deanery sort of put into subgroups that you would apply to, and then be anywhere in that subgroup?
We have 4 subgroups, and yes, at the application level you make a preference for one of those 4. And then once you've accepted a post, a position rotation, we will then work out exactly where we're going to put you, and that's when there's an element of choice and an element that will actually everyone can get their first choice. Yeah.
One of the positive things about the deanery, some deaneries, when I was at recruitment selection this year, one of the most common questions was, does my interview, does my knowledge test count? Do I get ranked? And I think that's because some deaneries actually rank you, and your choice of specialty is based on ranking. But actually, we're very, very fair here, and as long as things aren't changing, then actually you are treated equally. You get onto the same program, you're treated equally. No one's ranked you just because you did really well on one day does not mean that you will get all your top choices. Just because you didn't do as well as you could have done doesn't mean that you'll get choices that you may not want. And I think that's a massively positive thing that we do that I know certain other dealers don't do because ranking.
Yes.
Okay, been some excellent questions, and I think we'll take maybe one more from the floor before we move on to viewing the RCGP video and then one of our very own videos with one of our fabulous trainees from Westlake. Mike, did you have a further question?
When we talked about how great it is to go into the GP scheme and how to become a GP, I think a lot of the questions are often asked is how best to prepare for the assessment process of general practice. Because it's quite different from a lot of the specialties in terms of the content. So what would the panel suggest that training do to prepare for the GP?
To prepare for the machine marked test, I think is difficult to answer. And actually, just go for it because most people get through. To prepare specifically for the assessment centre, I think is quite risky. Because what you often find is that people who sit down and rehearse and concentrate on what they think they need to do to impress the assessor are forgetting the basic purpose of the assessment centre. And what you'll be faced with is a simulator, an actor, who is paid to deliver to a script, semi-script. If you listen to what they're saying and have a humanistic response to them, you're much more likely to pass than if you sit there thinking, oh goodness, I've got to say this, oh goodness, I've got to say that. So my honest answer is, if you've got a medical degree, if you have been practicing in a post in which you've been dealing with human beings, just be a human being. Be yourself, and that's the best way to pass. Don't worry about it too much, because they're paid to give you the cues. Listening is key, as indeed it is in the whole of general practice. Because in specialty, I don't know anybody who sees a specialty doctor who hasn't got some investigation to do. And by far the majority of patients coming into the GP surgery, for that next 10 minutes, it's you and them. And that's it. So listening is an absolute key skill. So not surprisingly, at recruitment and selection, what we do is to take a little view about, can this person basically listen? Well, a bit more complicated than that. We like you to respond as well. But if you find yourself talking a lot, then you're in the wrong place. Okay.
Any more questions?
I think so. Would we like to move to the